This next video clip looks at the cervical CROM. If during the course of your examination of your patient's neck you find clear restriction in a particular direction or directions of movement, again, just like the extremity joints, we need to quantify that motion. So we're going to use the cervical CROM to do that. This side compass here is a compass we use to quantify cervical flexion, cervical extension. So we make sure that the patient's starting in a zero position. And then, Hannah, I want you to flex your head as far forward as possible. If the patient's painful, only do one repetition. If they're not, look forward and flex again. That's the second rep. And then come back up, flex again, and take the average of 3 measurements. Okay? We can read that right on the dial right there. Same for extension. I want you to look up at the ceiling, quantify this movement. If it's painful, only have the patient perform the movement once and get the patient right out of that position right away. If the patient's not too painful, take the average of 3. Oftentimes patients don't move fully the first time. So if you take the average of 3, or if even you take the last one, that can be your measurement for cervical extension. And if you would turn 90 degrees and face Emmett, with a little light tactile cueing, trying to keep the patient's head looking right straight forward, I want you to bring your left ear to your left shoulder. And let's quantify left side bending. Well, let's just do one repetition in this case, and now let's do right side bending. And we'll get a measurement for that. Okay? And then if you turn 90 degrees, one more time. Then I have to use the rotation piece on the CROM. You put that on just like this, and we have to kind of kneel behind the patient and make sure that we zero out the goniometer. Okay? And then let's have you right rotate, yeah, as far as you can. Again, we're behind the patient, and we see what the rotation is. 1 repetition only if your patient is clearly uncomfortable with that motion. If they're not, if it's just a stiffness impairment, again, take the average of 3. And then let's do a left rotation. And same deal. 1 rep if it's painful, the average of 3 if you like, if not painful. And again, this allows us to quantify motion in all the cardinal planes. To repeat, if there's a clear movement restriction, we need to measure it. If during your visual analysis of cervical motion, which we demonstrated in some other video clips, if it's clear that a movement is not restricted, you do not need to pull this equipment out. There's no need to measure a full and normal motion, only one that's limited.